It is 9:50. It's time for us to move forward with our final session of today and our conference. And this is a really, I'm really excited about this session. I've been excited about all the sessions, quite frankly. This one is kind of unique this year, and it's being facilitated in part presented by Julia Garvey, who I'm sure for those of you who have attended this conference before, she is familiar to you. She is a long time, I mean, since the very beginning of the marketplace, has been in turn a CAC and a navigator, and just a wealth of knowledge, and brought this idea forward of trying to give a little bit of a closer look at how do you actually try to resolve challenging or case questions, really, just doing the research. And it's not something we have fully explored in a conference session before, so I'm excited that we're getting a chance to do that. And I thank Julia for the idea in the first place. So before we get started, just a reminder, I think we have or will post today's evaluation link in the chat for today's sessions. And so this is different than the one that you had this morning. It was for yesterday. So please do give us feedback on this one before we close out today. And of course, you can find it on our website as well. And then after today's session, as yesterday, I'll do the gift card drawing. And just a final reminder about the session on Friday for those of you who want a little bit more assistance in understanding content, especially if you're preparing for the state exam. All right, well, let me introduce Julia a little bit more formally. So as I mentioned, she's been CAC and a navigator since the very beginning of the Affordable Care Act marketplace. She is at Partnership Community Health Center and is a passionate learner and thoughtful educator. And I definitely agree with that. She is in many spaces, often at the invitation of others, just given her experience and expertise, and really, really thoughtful questions and ideas based on what she sees, both of what's happening at the policy level and then what she sees is happening on the ground or anticipates could happen on the ground with consumers and trying to navigate this really complex system we have. She loves the challenge of finding a path to coverage and the meaningful outcome of helping people access care. And I think that's really what brought Rise to this session, is figuring out that path to coverage. So I'm going to hand it over to you, Julia.
Thank you, Allison. And if you'll be patient with me while I try to gracefully transition to my slideshow. Okay, hello everybody. Are we good on sound? We're good on our slide deck here. And I just have to thank all the previous presenters, and I really could have sat for the rest of the day with Caroline and Jenny listening to their discussion. I have a lot of feelings about the work that we're moving into, but it's all rooted in our day-to-day practices. And what I hope to share with you today is that transition from understanding policy to what it looks like in the practice of our enrollment work on behalf of our patients, community members who are really seeking coverage to get care. So what I'll be sharing with you today is what it looks like from my desk, the resources that I use, the tools that I use, and to help me tell this story today, I would like to introduce my supporting staff here. Ryan Jensen is a staff development specialist in the Economics Support Department in Outagamie County. Ryan has worked in income maintenance for over 9 years since graduating from UW-Oshkosh in 2015, 4 of which of those years have been spent as a staff development specialist, so he is a trainer. And then Tony Lee is a longtime colleague as well. He's the lead navigator in the counties of Brown, Dorr, and Kewaunee, and Manitowoc. And prior to that, he worked as a CAC at a federally qualified health center in Green Bay for 11 years. Both of these guys love doing the work that they do. They're subject matter experts, And thank you, Allison, for introducing that I'm also presenting, because about 80% of this is me sharing what I think is really valuable and what I'm passionate about. So I didn't want you to wonder, why does she keep talking? Let me share with you what we're going to be talking about today, is that we're going to transition again from the policies that we've been discussing that impact our work to how to do the work effectively and efficiently. We're going to look at tools like FPL charts and handbooks, utilizing the marketplace and Medicaid program specific resources, and most especially developing relationships with subject matter experts to help us fully understand and get people across the goal line of getting enrolled in programs that allow them to access care. And then we're going to tie it all together at the end by using an example of a household that I helped recently who had a complex scenario. And I would have to say that a lot of our cases are complex. There's very few that are really just easy to understand and get coverage for. And I've learned a lot over the years, but I forget the details, or sometimes even the basics. And sometimes what I think I know has changed, or I'm just wrong. I want to work effectively and use tools to help me better understand which path to start down in the first place. And having a deeper understanding of these policies or eligibility criteria helps me advocate for correct determinations. Having relationships built with partners who are expert at their work allows me to ask questions and get answers quickly. I also use these resources to provide health insurance literacy. For example, we are applying for Wisconsin Medicaid. The program is called Badger Care, and you're going to get a forward health card in the mail. I help people understand how to report changes or transition to other insurances without experiencing gaps in coverage, and how to use their coverage to access care. Because that's the purpose of our work, coverage to care. Nobody comes in because they want to talk about health insurance. Like Francisco said the other day, they'd close the door. But they come because they want to treat an illness before it drives them to the ER, or to see a behavioral health counselor, to get their diabetes medication, to utilize free preventive screenings, and to avoid or reduce medical debt. So this is an actual screenshot of my desktop here. And I wanted to show you how I lay out and store all this information. This is designed so that I can locate the qualified health plans, the Forward Health Portal, healthcare.gov, and access quickly and efficiently. I have folders stored where I keep the handbooks and the FPL guides, information about specific populations like young adults or immigrants in a whole separate folder so that I can find what I need quickly. So we're going to start talking about the marketplace, both building on the basics and help with tracking some of these changes that are coming. And we start with Beyond the Basics. And I did this, Jenny, before we even knew you were presenting twice. We're glad to have you, because this is the gold standard for the resources that we use to get us understanding how to talk about marketplace coverage, plans, and prices. So the first thing I use is this yearly guidelines and thresholds. And the 2026 is already out. What I'd like you to take note of is that there's going to be big changes in what people pay in the coming years. I don't like to, just as a practice, overestimate someone's income, because I want to really look to see where that puts you in these thresholds, meaning I don't want to overestimate by $1,000 if that means that your out-of-pocket costs are going to change significantly by overestimating. However, as we move into a coverage year in which there are no repayment caps, we're going to have a more nuanced discussion with people about counting their income, tracking and reporting changes, and the impact that might have both on their care costs and when they go to do taxes. So we've talked quite a bit about the premium prices going up this year, not only because qualified health plans are increasing their rates, but with the removal of the enhanced premium tax credits, it means that people are expected to pay more of their household income towards their premium costs. And I encourage you to take out your 2025 yearly guideline and thresholds and compare it to what 2026 is going to look like. Remember that people were able to get zero premium plans below 150% because they had zero responsibility of an expected premium contribution of their own income, 0%. Now it's up to 4%. Moving on to compare, the 200% last year was, I believe, 2%. Now it's going to be 6%, almost 7%. This really helps us understand, maybe we could use this to explain to people why, but really for us to understand when we start seeing those prices shared, why this is happening. The yearly guidelines and thresholds helps me understand, talking to parents about what a income threshold is for their kids who might work at Dairy Queen in the summer. Does their income need to be added into the marketplace application? If it's above this threshold, it certainly does. And sometimes I add it just to test whether or not healthcare.gov is doing their work right. But in general, if they're below that threshold, it doesn't need to be added. Again, sometimes I test and make for sure healthcare.gov is doing its job right. And remember that this yearly guidelines and thresholds shows the income limit caps because it impacts the people who are enrolled in coverage in 2025. There are still caps for people who go to do their taxes this spring, but those are going to go away. And this might seem silly to you, but I have a laminated calendar on my desk that I use to show people and explain this, and this is the year in which we are trying to calculate your income, because people want to talk about their 2024 income, or if you're working with someone mid-year and you're trying to calculate income for the year, it's helpful to me to have a calendar in which I can count the pay periods in the year or count the weeks. That helps me do the math. If you had a job from January until mid-March, and then June you didn't work, and July you have a new job, it just helps me use this as a tool to count the weeks and the pay periods, and it helps people understand what we're talking about in terms of income that we're trying to count for this year or next year. And then I literally have a calculator that I love because it tracks all of your little all the entries that you do, so you can scroll back up and confirm your numbers. I know a lot of people use their desktop calculators, but I love my little calculator. I'm sure I stole it from one of my kids. Okay, the Beyond the Basics has the Bible of SEP charts posted, and I use this to check things that I thought I knew or to understand the details of whether a qualifying event meets the standard for a special enrollment. And this came up recently in a CMS webinar where they mentioned that people have 90 days after the loss of Medicaid. And I thought, that's not right. And sure enough, it is 90 days after the loss of Medicaid. That was effective in January of 2024. I thought it was only during COVID. So there are many times that I go back and fact check what I think I know about an SEP. And it's also important to remember that this chart shows not only what qualifying events will allow someone to get coverage outside of open enrollment, but what reported changes to an existing healthcare.gov application may impact, like, can I change plans or medal levels if I report a change of income mid-year? If you like to nerd out, and these are Jenny's words and their resources, on the impact of tax credits and tax filing, Beyond the Basics has a Healthcare Assister's Guide to Tax Rules. For instance, I'm interested in understanding whether or not immigrants with incomes less than 100% of the federal poverty level who will no longer be eligible for tax credits in 2026, many of whom are elder parents who have come to join their families here and currently have the full benefit of tax credits, could they meet the criteria of being a qualified adult in one of their children's homes? I'm hoping that this is a question that that Beyond the Basics will address in their upcoming webinars. And Beyond the Basics has many more resources, including the webinars that'll be starting soon, today's slide deck, and I will be printing some of these slides from their deck to keep me on track about these changes. Healthcare.gov also has really expanded the information that they provide on their website. Sometimes the first thing I do when I have a question is go right to the website to search. I always start my appointments with the C plans and prices after we talk about income counting, because people are really anxious about what things will cost. And I like to use this as a first step even before I do an application, or to see the impact of a income change before we do it. Because again, that can be a nuanced discussion. I also use this to, again, see topics. For example, I hate to just tell someone you don't qualify for tax credits because you might have affordable coverage offered from your job. I don't like to just tell people no. I like to show them that this is in fact in the law, and provide them some resources to understand that, instead of the affordable coverage or what they consider is not affordable from their job. I use it to search specific topics like COBRA. In fact, I had someone come to me recently who said, yeah, I'm going to take COBRA for a month because I have some research to do about providers and provider networks. And then I'm going to come to the marketplace after having lost employer coverage. And I thought, well, you can't do that. You can't just drop COBRA after you've enrolled. But in fact, if you are still within that 60-day window to use your SEP, you can. And this is a case in which my applicant had done the research on the healthcare.gov website and understood this better than I did. So I'm going to take a pause here and let Tony talk about how he uses some of the tools to do our great enrollment work.
All right, thanks, Julia. Yeah, so for one of the first topics that I speak with my consumers about is their access to health insurance through their employer. One thing that I've learned over the years is that using the phrase, I like to use the phrase when I'm speaking with them, is I ask them, is your employer, or does your employer offer insurance, versus do you have access to the insurance? Because sometimes what I've learned is that when I say, do you have access to it, in their minds, they're thinking no, because it's not affordable, but yet they still have it, they still offer it. So for myself, I like to ask my consumers, does your employer offer insurance? So from there, if they say yes, that they do offer insurance, the one thing that we do talk about right away is the employer coverage tool, which is found on healthcare.gov. And then this is a tool that they bring to their employer, or they call their HR department, and they get answers to the tool. And then we go over what the affordability is. So for 2026 insurance, the affordability test for employer is 9.96. Right now for 2025, it's 9.02%. And then also on our website, on Covered Wisconsin's website, we have a great affordability worksheet that helps with the process. It's just another tool that I use just to get the math down to see if it is affordable or if it's not affordable. What I've seen is that right now, many times the employee has access to the insurance versus the employee plus spouse. So many times the employee goes on the work insurance, and then the spouse goes on healthcare.gov insurance, because that affordability test is greater than the threshold for this year of 9.02. And like what Julia said, when it gets to the reasoning of why we're asking if what's your access to your employer insurance, I like to direct them, and sometimes I actually send them a link as well as to the reasoning why we're asking, or why I'm asking this question about your employer coverage, because it is the health law. So I give them a link, or I just read verbatim of what it says on healthcare.gov, just so they know that this isn't my rule. This is the healthcare.gov. This is the health law rule. So that does seem to help as well. All right, I think the next slide, please. All right, so after I do the employer coverage tool, the next thing you do, we do the application, and then we're picking plans. As you will find out, healthcare.gov is not always accurate in terms of who's in the network for providers and if the medication is covered or not. So what I like to do is for medications, I go directly to the qualified health plan website and see, and I pull up their PDF file. So for example, if I go to Common Ground's website, I pull up their PDF file, and then I get the exact spelling from the consumer, and then I do a Control F to find that medication on the website. Because if you misspell the word or you misspell the medication on the Qualifying Health Plan's website or on that Control F search, it won't come up. So you have to just make sure that it's spelled correctly. And then we go over, if it is covered, we do go over the tier, what's it covered. So a tier 1, tier 2, tier 3. But I would really recommend having that extra window open for the medication, for the formulary, as well as the provider. So like to find a doctor. Just because I have seen it where a doctor on healthcare.gov has a red X by it, but I'm like, I know they're in network. So then we go to the health plan's website and we do the search, and then they are in the network. So I'd really recommend having the formulary open. Make sure that you spell the medication correctly, and then have your other window open to find a doctor just to verify that that provider is or is not in the network. And I believe that is it for my 2 slides.
Yeah, thank you, Tony. Thanks a lot. So agents taught us about plan design right from the beginning of the Affordable Care Act. You can get through the application fairly easily, but it's really hard to understand and talk about plans. So agents who've been doing this work for years coached us and picked up the phone whenever we called to ask questions, and we deeply appreciate that relationship. They also sometimes have a deeper understanding of the insurance landscape. And sometimes agents hear industry information faster than we do, shared by the qualified health plans through their agent networks. They have information, for instance, on the short-term plans that they might sell or international coverage. And a lot of times agents aren't as deep into the Medicaid policies. And so we are reciprocal in our information sharing back to them about how to help their people who might have households that have someone qualified for Medicaid. It's also valuable to have connections within hospital systems in your area. Financial assistance advocates are really important to understand and understand their policies and application process, especially moving into a season and maybe a prolonged season where people are going to have to make hard decisions about plan selection, like whether to choose a bronze plan with lower premiums that they can afford, but taking on the risk of much higher out-of-pocket costs. Understanding, again, how to talk about financial assistance programs or charity care programs will be vital in helping reduce medical debt in our communities. ABC for Health recently held symposiums around the state, and I believe that financial assistance programs are largely underutilized, and I recommend that we know to have that discussion with people as we move into higher premium prices. It's also really nice to have the brain trust of our experienced navigators through asking questions to the group. We're going to talk more about the collaboration between our income maintenance and our economic support partners. Also, feel free again to email beyond the basics. Jenny Sullivan, they like to see what we're seeing on the ground and help us understand the policies that impact that work. And sometimes we're elevating things that they're not aware of in practice. There are also professional resources. Louise Norris is an agent who has a web blog. She does a really good job of explaining coverage and how that impacts families. And then keep in mind that there are a lot of professional resources that are approachable. Kaiser Family Foundation, Julie Ruvner has a podcast called What the Health, and that provides a deeper dive into policy. So we're going to transition to our first poll question, and at the end of the conference, we're going to be easy on you. These are yes/no questions. Do you have a phone-a-friend contact who helps you problem solve in the moment? Don't be distracted by my little picture there. In fact, bonus points for anyone who wants to answer that in the chat. But the question is, yes or no, do you have a phone-a-friend who helps you problem solve? We'll give that a minute. Yes, thank you for those faces. It took me a long time to craft this slide. Mike, whenever you're ready to share that. There you go. I'm really glad to hear that a lot of you are connected with other people to help us do this work. Okay, let's move on to our next section about Medicaid. And before we enter this discussion that includes some Medicaid program, I want to provide a personal disclaimer that watching Maciel's presentation on elderly, blind, and disabled Medicaid programs really underscored for me how much I don't know about Medicaid eligibility, but that's okay. I'm not trying to do the job of an eligibility worker or an income maintenance worker, nor am I trying to coach you to do that job of an IM worker. This section is designed to provide training on the programs or policies cited. I have not staffed the Q&A with policy ninjas like Adam said, although Adam does know a lot and he's in the chat. But I wanted you to view the tools and resources and relationships that help me as an assister to make better decisions about which path to start down and how to advocate for coverage in collaboration with IM workers. Starting with the FPL chart. I pulled this out for all of my discussions because in fact, one of our IM collaborators taught me the phrase that it resounds in my head every day: exhaust all Medicaid options first. I like to use this not only for me to understand where families might fall in the federal poverty level, but I show it to people in my office when they're having a hard time understanding, for instance, why do my kids qualify for Badger Care, but I do not? And many of us work with people for whom health insurance literacy is not high, or knowledge about Badger Care program income limits is not at the tip of everybody's fingers. So I keep this federal poverty level chart out to show people. I also use the Access website and have learned how to use it better starting during COVID times because I didn't want to clog up the phone lines doing renewals or helping people apply. And the more you spend on Access, what I encourage you to do is when you're in a trusted website, look at the resources that are embedded in there. Access has a lot more information available to you and to use on their website. I taught myself how to use the provider search so that I can help people select their HMO through Access rather than having them call the specialist over the phone. Okay, so talk a little bit about how I use the handbooks. And again, this is not for me to take the place of an eligibility worker, but when I want to understand something better so that I can relate it or understand, like IRIS. When I started doing this work, people would say, well, I get paid by IRIS. Well, what is IRIS? Who does this impact? What is IRIS income? And you can look more in the handbook. Again, we're not going to talk about the policy, but it allows people who need care to provide funding to a care provider. And that is shared with me in the handbook. I use the Badger Care Plus handbook a lot, not only for me, but to help explain to people how and why we're applying for this and what they might need. For instance, whenever I have a student in my office, it's helped me to understand how a Pell Grant or a scholarship might be counted as income in the semester in which they are in, spread out over. I can tell them, you're going to need to find a document that shows your the amount of grants that you're accepting and your fees, tuitions, and books. Knowing how to explain that to somebody gets them more prepared to get those documents and helps that application and eligibility process go faster. One great thing about the handbook is that it uses examples to help explain complex topics like income reporting changes. The language is, the income change must be reported by the 10th of the month following the month in which the total income exceeds its previous threshold. That doesn't make any sense to me until I see an example of that. And I can share then when someone calls and says, hey, I got a new job, when do I need to report this? And it comes in handy when you're talking with somebody, and this comes up quite a bit. People who have had to leave their jobs and are receiving short or long-term disability from an employer. It's really important to understand this, and this is under the heading of sick pay in the handbook. If the employee only paid for those premiums, meaning it's not a benefit paid for by both the employee and the employer, it's not counted as wages in Badger Care. And again, knowing this means that when I'm talking to somebody who reports that their only income right now is long-term disability, that I can ask the question, who's paying for that benefit? Because if you're the only one paying for it, I can make the decision to help you, if it's within the income limit, apply for a Badger Care program rather than going directly to the marketplace. I use the DHS website a lot to find out more about programs, but also to provide supporting documents. For instance, MAP is a program that I look at a lot. When somebody reports to me that they just lost Badger Care because they became disabled or their disability was approved and now they're making more money with their Social Security disability, rather than looking right at the marketplace, I know that if I assess for the eligibility requirements of, is your income below 250% of the FPL? Do you have assets below $15,000? Do you have work or a work activity that can be supported or documented by in-kind work? That I can help make the right choice to apply for MAP and help get those documents rolling for people, or explain in-kind income, which is really hard for people to understand. But again, in fact, Ryan, how about if I turn this over to you and let you explain in-kind income, because this is where you do your beautiful work, and we'll talk about how we can support people in using these documents.
Hello again. Yeah, my name is Ryan with Outagamie County, one of the trainers here. And with in-kind income, first of all, we want to make sure that we have these conversations with people about the MAP program so that the right people know that this could be an option for them. And our computer system isn't necessarily tailored in a way that will always look to do this. Countless times we'll get applications that will have someone who is disabled, who's above 100% of the federal poverty level, and would initially just be nudged into having a Medicaid deductible. Because if their application doesn't indicate that they are doing any kind of work up front, again, that's where they'll get marshaled if we're not, again, kind of thinking MAP ahead of time. But with the in-kind work, something that we can do is pend for the question, are you working on that specific page that asks if someone is, if they're disabled, if they want MAP? We can kind of put a question mark next to that in order to hold up the system, so that if there is someone that would be a MAP candidate, it allows us to kind of open that dialogue and discuss this work requirement with them. But again, that requires proactive thought on our part and a knowledge of this computer system to make that happen. Sometimes it can slip through the cracks. But with in-kind work, once we have that dialogue with someone and they indicate, yes, I can do some in-kind work and I can meet this work requirement, we like to have the discussion with them of, what exactly is in-kind work? Real simple stuff. Again, you can wash your neighbor's dishes and they buy you a McDonald's cheeseburger. You can cat sit or dog sit for a friend or family member, or hey, drop the grandkids off. I'll watch them for a little bit, and you bring me to the store to buy groceries, or you bring me to a doctor's appointment. Most people are already doing something that would satisfy in-kind work. And so it's just a matter of, again, putting it on a piece of paper and getting it to us so that we can say, yes, you're meeting the MAP work requirement. The other thing that is nice for us to proactively do with people who are going to get involved with MAP and get involved doing this in-kind work, it just has to be 1 hour per month. Only put that you're doing 1 hour per month on the form. Again, there's no extra credit that can come about from, oh, I helped my daughter with X, Y, and Z, and it's 20 or 40 hours a month. Good job. Still only put one hour, because you put more than that, it could result in an increased MAP premium, which, again, for something like this, that's not really tangible income, but is strictly used to satisfy the work requirement, just put 1 hour. So those are the kind of conversations that we like to have.
Is it helpful, Ryan, when we're doing our work and assessing, if we can explain in-kind work, get them started on filling out a form and get that faxed as soon as possible, just so even on your end you see, oh, we're looking at MAP, and because this is an in-kind form coming in.
Exactly that. It's such a big help, because for as much again, proactive guidance that we'd like to put out there to the number of workers that we have, of like, hey, if you are working on a case where there's someone with a disability and you can see their income and they would be in deductible territory, but they could get MAP, we need to, again, look to question that can they work question, and pend for that so that dialogue can open. But you know, there are going to be instances where maybe that slips through the cracks, that's not seen, where we don't act on that, and then here we go, just opening people for deductibles or establishing deductibles for people that really could have something better and could have something now, and not have that deductible hurdle to get over. So having a form up front with an application, or again, indicating on an application that you could be doing some in-kind work, immediately will put into a worker's brain, ooh, MAP. You know, this is something we can pen for, and we can get them the verification form right away if it's not already provided. But again, it just reduces the likelihood that we create work down the road, as far as feeling like we need to either reapply or making calls to the call center to iron things out, when there can be some of that groundwork done ahead of time to make things go a little bit smoother.
Thanks, Ryan. I'm going to bring you back in a minute.
Yep.
So where do we find these forms? DHS has a forms library. I also find success if I Google DHS and in-kind form. As long as you're going to the official DHS website, you can usually get that PDF to populate in your search. These are forms that I have bookmarked for myself so that I can find them quickly, because I use them a lot. I also use the self-employment income report for people who may have a new self-employment that they've not filed taxes for in the past. And I print extra pages because the consortia wants each column to represent a month in which that self-employment work has been done. And the more you can provide them with information, the better, if you don't have taxes to show. I love this DHS Partner Resource Guide, and I use it a lot for outreach, so that when I'm meeting with community members or community health workers, that they can use this to explain programs that they may not be as intimately knowledgeable about. It's a beautiful glossy guide, and you can order this from the DHS website and they will send it to you. They will print these copies in English and Spanish and send it to you. I have a box of 200 in my office right now that I'll be using over the course of the year in outreach. DHS also has great resources for enrollment assisters that are designed to help us understand how to use Access, how to use the mobile app. I should share out, and maybe I'll provide this in resources later. I don't know if I have a link right now, but Maciel has pulled together a resource guide for his sisters that link to these Vimeos, to all kinds of resources to use in our work. And we'll make for sure that we get those to you. And for those of you who are new to the work, I would like to put in your head that the Forward Health portal, or the Forward Health Member Services, is different than calling the income maintenance workers. So if you're having trouble in the Access website, or you need to replace a card, or you need to understand why isn't my coverage showing in the Forward Health portal, that's a member service call. It's the number that people have on the back of their Forward Health card. There's also a way to communicate with the state about trends that you might be seeing in terms of how policies are impacting people, or a question about how they are, whenever you have questions, but they're not case-specific questions. Again, Maciel and her team will look at these, but I don't recommend sending specific case information. I'm going to direct you in a minute to having better relationships locally with your income maintenance agency. It's faster, it's a better way to resolve case-specific issues. And then keep in mind too that members do have the ability to file a fair hearing, or if they question an eligibility. But again, I really feel like working collaboratively with your IM, you can resolve a lot of these issues before a fair hearing is needed. So building relationships within your income maintenance agency starts with your daily calls to the IM. You're calling, you're introducing yourself and where you work, you're getting permission with your applicant to be on call with them unless you have an authorized representative form on file. And this just is, we've been doing this for years in our community, and generally when we call, the income maintenance people they know who we are and that we're really trying to work collaboratively with them. Sometimes there are things that we kind of are advocating for, and it's okay to ask a worker who may not be as experienced as we are on a very specific thing, like that sick pay. I just want to put in front of you that this is a benefit paid for by him only. We're going to get you that form. You can ask that worker, can you check with a lead? And they'll put you on hold, and they'll come back with, maybe a more detailed response. So Ryan, I wanted to bring you into this question or this slide because you made a nod before that there's a lot of information that IM workers need to know institutionally, and a lot of workarounds within the care system. Can you talk a little bit about, for instance, like care provider income?
Yeah, so live-in care providers.
Yep.
Absolutely. So for one, that income, most of the time, if not all the time, it doesn't show up in the state wage match to know it exists in the first place. So the only time we're going to hear about it is if someone is upfront and lets us know, yep, I get paid for taking care of so-and-so, which is great. So we'll build an employment page for that, and we will ask you how much you're getting per hour, how many hours are you getting paid for per pay period. Great, and we can stick a question mark on it that would make it penned. There's no question on that employment page that will stand out to us to go, ooh, is this income for a person being a live-in care provider? It requires, again, it's dependent on pre-knowledge from the worker to be able to go, oh, okay, you're getting paid for taking care of someone. Do they live with you? Ooh, you might be a live-in care provider. Then I need to know how to go about, utilizing the policy that exists in the handbook, and you go into the handbook and it'll tell you, all right, if they meet this criteria, this income won't count for Badger Care, and it only won't count for Badger Care. Still counts for EBD Medicaid, still counts for food share and all the other stuff. But then we need to get into using the overrides on that employment page to say, still count the income for these programs, but we need to do a little bit more with regards to Badger Care, which requires us sending a form that the person needs to fill out to indicate whether or not they meet the specific criteria. And if we get that form back and they meet the criteria, great. Your Badger Care budget will then reflect $0 for that live-in care provider income. So that's an example of that one. Even just thinking back to Julia talking previously about like the short-term disability or that sick and disability pay someone gets from their job. Someone reports it on an application. I get short-term disability. If we create an unearned income page for that, there's nothing on that unearned income page that will prompt us to go, who paid that premium for that short-term disabilities, to call out to us that that policy could be coming into play. So again, sometimes workers enter that page, oh, you're over income, without even having asked that question, because again, it's dependent on pre-policy knowledge going into that. And we're kind of responsible to know a lot of things. So again, there could be instances where things, again, slip through the cracks. So these
Hold
are
on,
all things.
Brian.
Yeah.
Brian, I just want to say that we're building, you can, for the attendees, you can tell, we're going to build towards this in a story coming up
Yeah.
soon. But I'm going to switch you to, for instance, when we're helping someone apply for emergency Medicaid, there's no question in the Access asks, have you had an emergency? But it doesn't necessarily prompt to a worker, or does it? Whether we're applying for emergency Medicaid for an immigrant that doesn't have a immigrant status to have regular Badger care.
Yep. So another great point of an access application in a very overlookable way can report, yes, this person has had an emergency. And that can cross over into our care system. There's a question on the medical gatepost that we can tick to say, yes, this person has had an emergency or been in an accident in the last 3 months. And then nothing comes of that. It almost just feels like a survey question. There's no additional page that's prompted to gather more information. Again, it's dependent on pre-knowledge to remember, ooh, this person had the emergency. Once I get to the results, I may need to go back and manually consider and look at emergency Medicaid eligibility. So again, not the most helpful, dependent on a lot of things.
Thanks. And we've already really covered, I think, a good job about how we can collaboratively work with you on making for sure you see that we're requesting MAP when we get to that work question. Go ahead.
No, I was going to say that's exactly it. Again, it just all comes back to that proactive stuff just to help us out, help us, help you, help the client, which is the most important thing.
Right. So you may ask, how do I find a Ryan Jensen in my life? And it is super, super helpful to have these relationships where you can then send an email to somebody without PII and ask a question. Not only am I connected to Ryan and Outagamie County, but you are all eligible to reach out to your income maintenance operational leads. There are always 2 leads within a county, and introduce yourself and your organization and the work that you do. Now, this is not a person that you're going to send your case information to, but it's always really nice to let your IM know that you're doing this work, because when they have questions from people who are denied Badger care and need to be connected to services around getting enrolled in Marketplace, they will know that you're doing this work. So all of these links, by the way, in my slides are live. So this link will show you who your IM leads are within your consortium. Okay, again, we're easy on you today in terms of poll questions. It's a yes or no. Let us know, have you built relationships within your IM? Do you have a Ryan that you can email? If you've been around for a while, you've seen Kaw come to our conference here and share her knowledge. My whole phrase about exhaust all Medicaid options first came from an IM worker, and it's just so valuable to be able to connect with IM, not only on your calls, but even bonus points if you can email someone that can provide you with some information. Mike, how we doing there?
Apparently having difficulty with the mute button. We'll give that just another 10 seconds and we'll close that out.
All right. Well, it's great that a lot of you do, and I hope that this inspires you to make and forge some relationships within your county. And if you want some assistance doing that, I'd be happy to collaboratively email with you if you'd like that, that boost, that warm handoff. So I'm going to move on now and pull it all together by talking about an actual family that I assisted recently, because I think it really underscores how I use these tools, resources, and relationships to do my work on a daily basis. So here is our family, Jack and Jill, and their adult son, Joe. Jill had an accident in mid-June while uninsured. And in fact, I learned that Jill had been uninsured for about 10 years. She has a large uncompensated care bill from a hospital, and she needs follow-up care. The family had recent contact with an IM agency assessing MAP for coverage for Jack. And, you know, they looked at the household income, but based on what they saw, they were told that Jill did not qualify for Badger Care, and so she did not apply for Badger Care. Subsequently, they enrolled over the phone with an insurance company that I have changed the name for, but they enrolled in Acme Health Insurance. And when this insurance was discussed at the hospital, the social worker that knows me and our work really questioned, who is Acme Health? I've never heard of that. I'm concerned about you using this coverage here at the hospital, and referred this family to me. So here's how I kind of start pulling at the threads of this. First of all, I didn't know Acme Health. Is she enrolled in a legitimate marketplace plan with tax credits? And if so, you know, if Acme is not accepted at the hospital, does she have a qualifying event to possibly change plans? And then I heard that she was a care provider. I had questions about what would count as taxable income on the marketplace application. And then I reminded myself of my motto, which I didn't apply first: exhaust all Medicaid options first. Is she maybe eligible for Badger Care? So here's where I started. I wanted to know more about Acme Health Insurance. So I looked on their website, and it turns out they do sell individual and family plans, which are what marketplace plans look like in their language, but they're headquartered in Ohio and Michigan. I used their provider search tool on their website with our address, and no providers were found in our area. So then I called the marketplace to see, you know, do I not just know this plan? Called to see, is she enrolled in a marketplace plan at all without tax credits? Because sometimes we're finding that people are enrolled in plans that they don't know that they have. There were 3 incomplete applications with no agent's name attached, but she was not enrolled in a marketplace plan with tax credits. And then finally, I went to our best resource, our state OCI map of comprehensive health insurance companies, and you can look in your county to see all the qualified health plans that are selling plans both on and off the exchange or on the marketplace, and Acme is nowhere in the state. So I was pretty confident that Acme was going to do them no good. So Acme represented their plan as all access. Now remember, Sharon Asa said yesterday to look for written policy information before they enroll, and that sometimes people use high pressure sales tactics. This is exactly what happened to this family. They enrolled in something with a premium of $235 plus a $100 enrollment fee. That's a red flag. They had no information sent to them either by mail or email about their plan. And Jill was harassed when she tried to cancel this plan. It took them days calling to say, I don't want this, get me out from underneath this. They insisted it would be accepted by all providers. She finally had to go to her bank to stop that credit card payment. And then we used that information to file a complaint on the OCI website, which is really easy, everybody. The more you do it, the easier it is. And sadly, there's still opportunities to report fraud that are impacting people. You can file it on behalf of the person, or you can file it on your own, just to say, this is something that I have observed of someone. Provide all the information that you can, and they will follow up with either you or the person whose the complaint is being filed on behalf of. So let's break down what I learned about the household's income, okay? Because this is the meat and potatoes. Jack, who is enrolled in the MAP program, is a disabled vet and a retired electrician. He receives Social Security disability, a VA disability payment, and a union pension. Jill is an in-home care provider for both Jack and Joe, who was born with a disability. And so she gets IRIS income for both Jack and Joe. And then Joe is on Medicaid and he receives SSI income. So when you add all these numbers up, it adds up to $6,795 a month. And in fact, Jill does their household taxes. And on line 11 of their 1040, their adjusted gross income is $50,000. So which of these income sources should be counted for Marketplace or Medicaid? So using my relationships, I sent an email to a navigator contact who is close with a tax preparer. And the information came back that those care provider payments could be excluded from income. At the same time, I sent Ryan an email describing the income sources, and his email back to me was that live-in care providers, VA disability, and the son's SSI income are not counted income for Badger Care. This is a actual the IRIS notice, or the notice that was sent to me, and it aligns. This is from the care provider vendor saying that your income may be excluded. And then I can confirm that information and see whether or not Jill meets the criteria as a live-in care provider to have that income waived. And I'm not going to go over the criteria, but it's in the body of the content in the handbook. And in fact, she did meet that criteria, and they reference a form to be filled out to show that she met that criteria and that income could be excluded for Medicaid. I also looked up veterans benefits and SSI Medicaid, and the handbook tells me they are not countable for Medicaid, for Badger Care. So let's go back and look at their household income with this new information. And all that we are counting then when we're looking at income for Badger Care for Jill is the Social Security disability and the union pension. That brings their counted monthly income for Badger Care to $1,780, and the income limit for a household of 3, because Joe is a qualified adult tax dependent, is $2,220. So how do we get this correct determination? We called the income maintenance agency together, and there was already a case for Jack because he has MAP coverage, and we asked, can we look again for eligibility for Jill with a back date to June 1st, because remember, she ended up in the hospital mid-June. Because I knew that there would be a form to be completed, I looked up that form, and the IM worker recommended completing that form to show that she provided care for both Jack and Joe, and we completed those in my office on that same day and faxed them immediately. Drum roll. Jill got her coverage of Badger Care approved back to June 1st, which is going to cover all of that huge hospital bill and any follow-up care that she has. OCI is in the process of following up with her regarding that Acme Health. They're going to do their investigative work to see whether or not they were sold or misrepresented a plan that was not suitable for them. And now think about this. Their sources of income are really not going to change a lot. Unless Jill gets a job outside of her care providing, and it doesn't sound like she can. When they do their annual renewals, Jill should be eligible to remain on Badger Care until she turns 65. We've just opened up a whole new pathway of coverage for her and access to care that she's not had for 10 years. And it's the access to care that the reason that we're doing all of this. She has not had any preventive care. She has not had a mammogram, a colonoscopy. She is 60. She has done none of this. She's been caring for other people in her household and wearing herself down. And it's only because she fell down the stairs that she ended up in the doctor's office. And I don't wish her unwellness, but boy, am I glad that we had this opportunity to connect her to coverage. So there's another aspect to this that you may have already noted. She's been doing her own taxes, and I'm pretty sure she has been counting her care provider income as accountable income, and she may have the opportunity to meet a tax professional, and you can file amended taxes back 3 years. So this also has a financial wellness component, all because we're doing our work to connect someone to health insurance. Do not underestimate the income or the impact of the work that we do on the families that we serve. This whole case took me a week because I efficiently understood, who to ask questions for. And I hope that this has been helpful to you to see these examples. Ooh, I'm right on time. Let me stop this and see, Adam, if there's any questions. I've not been watching the chat at all.
That's okay, Julia. That's what I'm here for. There are a couple that I think we should definitely answer. One is, and I think this speaks to how you and I approach enrollment assistance work. So I think there's actually a larger question here, which is, do you calculate income before looking at the window shopping tool so the income is accurate? I noticed previously when doing the window tool, getting an estimate from the patient that the prices came up would leave patients uninterested. They'd probably get scared away. But going through the application and doing it there, they'd calculate it correctly and they would be much more likely to get insurance. So do you want to talk about that?
I do. And you know what? I have learned that I use a lot of paper and pens to mark out accurately, what were you doing from January until the end of the year on all the changes of income and the people in your household who have income. And I map that all out because, again, I want to know not only what is your income right now, because you might be Badger Care eligible right now, or you might be eligible for gap filling because your income for the year has been low. So yes, I always spend time on the income counting thoroughly before I go to preview plans and prices, not only before we start a new application, but in consideration of reporting changes.
Right. Yeah, I think I harped on that a lot during pre-licensing, of just get it all out beforehand, right? Like that's a great way to approach working with consumers. This next one, I don't know that we have an answer. It's probably more of a Ryan question, but I don't think we know yet. But my Medicaid curiosity question is, I'm wondering if the doctor waiver that could be filed as a waiver for the work requirement for food share will be the same as for any Medicaid work requirements in the future.
That's a good question for Ryan. Ryan, how can we incorporate that provider form to help IM workers see that we're applying for emergency Medicaid?
I'm reading the question and trying to understand it in real time and make sure I'm fully understanding it. So can you give me a minute to reread that question and come up with something in my head here?
You bet.
Thank you.
Adam, have I stopped sharing?
Yes.
Okay. Sometimes you get lost in all the functions of your slideshow.
Sure. And I can actually ask Julia, you this kind of third question, because it's mostly for you, but it does include a shout out for Ryan and his expertise. So we do appreciate having him here and having an IM representative at all. But people want to know how they can work better with IM and also advocate for just better training and I think better relationships with their IM workers. So Julia, how do you make those relationships and how do you give information to IM workers about the things you are seeing and worried about?
I do try to understand as much as I can about the programs we're applying for. And because I've been doing this for a long time, I've seen things over time. Again, I don't weaponize using the handbook. It just helps me understand what policies may be. And, I've been doing this for 11 years. There might be a new IM worker, and it takes, from talking to Ryan, a long time to be fully trained on the plethora of Medicaid programs, and even more so to know how to work with their CARES system to input data to get the right income. I don't think we have any concept of how challenging that is on their end. And just to, work, I know it gets frustrating and we sometimes feel like, why didn't they see what we wanted? But there are limitations to what the Access application provides. And so this collaboration where we get a lot more information from the people that we're working with across our desks than they see in an application. And that's why this collaboration or asking, can we look again? Or can you help me understand? Ryan, would you add anything to that?
I think our conversations too also help to highlight areas where we might be falling short, where again, you bring to our attention, hey, I had this case where the live-in care provider stuff wasn't considered correctly. And then it can spark things like, oh yeah, you know what? We've noticed a few cases like that too. Wouldn't hurt for us to shoot out a reminder to everyone of like, hey guys, we got to be on top of this policy here. Again, there's nothing in the system that will bring this to your attention. We have to be aware of it on our own to make sure that we're doing things correctly. So again, it's those conversations that will call out instances or times when it's good for us to have that reminder. I also have an answer to that question from previously, if you would like that now as well.
Well, there's actually just a clarification on it, that this wasn't about emergency services at all, or emergency food share even. But they're asking about if that will be the same form for Medicaid work requirements that might be implemented in the future. And I don't think we know. I think that would be nice and convenient if it was, but I think DHS will have to tell us the answer to that.
Well, I can, I guess, contribute something to it that
Please.
Right now, any exemptions from the work requirement for food share are not questionable. So if someone calls in to the call center and says, hey, I'm physically or mentally incapable of working, unless we find it questionable, it can be not questionable. There's no form that needs to be filled out at this point for those exemptions from that work requirement. So the MAP work requirement exemption will be its own standalone form, because along with the MAP work requirement exemption, there has to be I'm just bringing up the policy here that they would be going back to work within, or there's that return to work that has to be indicated with the form. So it's not just this like forever ongoing, I don't have to do the MAP work requirement. With the MAP exemption form, there again has to be that return to work that does occur.
Yeah, and the question just asking again, would the food share work waiver cover regular Medicaid work requirement as well for Badger Care? And I just don't think we know yet. I just don't think we'll know until DHS tells us. So I'm gonna let everybody off the hook with that one.
Okay.
And I'm sure we're at time here. In fact, you let us go over, everybody, and I appreciate, wow, we got through this whole conference, and I'm sure Allison has some ending words. Thank you again, Tony and Ryan. Everybody needs a Tony and Ryan in their life. So go build those relationships. Thanks, everybody.
Thank you so much. That was an awesome session, Julia, Ryan, and Tony, and a great way to close it out. So yes, I think just it was a great way to kind of pull it all together and see what this actually can look like on a daily basis. Hopefully that's not the kinds of situations you experience every day, because as Julia said, it took her a week, but we know sometimes they do, or longer. So thank you all for being here, for taking in all this information. It's a lot. Reminder that these recordings and the PowerPoints are available on the conference webpage on the Covering Wisconsin website. So please do go to those if you need to watch or look at any of these and follow up. Elizabeth has just shared the office hours, the Q&A session on Friday, the join link for that in the chat. And again, that's also on our website. And please do complete the evaluation form for today's sessions. Finally, our final gift card winner for today is Mike Rust. So congratulations to Mike. And we'll be sending out more information on those for all of our gift card recipients. And I think that's all I have. Of course, feel free. Oh, one more thing. The pre-licensing and continuing education certificates will be sent out by our team Elizabeth and Helena are working actively in the background already. So if you don't receive a certificate and feel that you should have, please do email us at thecoveringwi@cwi.wisc.edu. Reach out to us. One of us will direct you in the right place. Give us a few days for sure. It takes a little bit to get all that compiled. And Adam is clarifying that the office hours link on the page is referred to as the special session. So it'll be extra special. All right. Thank you, everybody. It's 11 o'clock. We are done. Congratulations, and hope to see you guys in some other space. All right. Take care.